RadioNOW 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. This week, I got the chance to speak with Jennifer Stansberry Miller about the rollout of the mental health crisis line 988, which will be operational on July 16th. Jennifer explained the new 3-digit number and its role in enhancing what is already in place in Indiana. To start our conversation, Jennifer tells us a little more about herself and her roles.
Jennifer Stansberry Miller. I'm a MSW, LCSW. I am the current program administrator of the Be Well Crisis Helpline at Mental Health America of Indiana. In addition to that, I am the program director and developer of the 988 Suicide and Crisis Lifeline that Mental Health America is standing up in support of the overall 988 outreach and program for the state of Indiana.
Excellent. And so the rollout of the number will be on July 16th. Why July 16th?
Correct. So July 16th is just a number that the federal government gave us for the official start date. So that is what we statewide are honoring as the go live. Excellent.
And Jennifer, can you give us a little bit of information and a little history of how 988 came to be?
Yeah, so 988 was definitely a nationwide effort led by various special interest groups, and of course those it directly affected the consumers, right? The consumer voice was heard by the federal government and special interest groups like Mental Health America, like NAMI, to understand that as a country, we needed to enhance access. We needed to enhance that response system. We needed to enhance facilities in which individuals in behavioral health crises, in active thoughts of suicide, need to reach out to and go to for support. Because of this, it's been a very long journey, but one that will be extraordinary to see roll out in these various phases, from the call center to the mobile crisis units to the freestanding stabilization centers, all within the next 10 years, at least nationwide. All of this is meant to enhance the already existing systems, whether that is the NSPL 1-800 number, that will continue to run. That number is not going away. However, after July 16th, if an individual does dial 988, they will reach a trained crisis specialist who can assist them with their behavioral health crisis, right? Mm-hmm. So it is an extraordinary time for our country, and very, it's great for the consumer. It's great for Hoosiers to be able to know that the existing system is being enhanced to better serve us overall.
Mm-hmm. And do you think a big part of this is our willingness to actually talk about our mental health and how we are feeling, how we are having these honest conversations?
I mean, absolutely, especially in light of COVID. We do know statistically mental health concerns nationwide are rising. Individuals with new and existing diagnoses continue to reach out for various forms of support. And overall, we do have a long way to go to reduce the stigma, right? We need to continue these mental health conversations. We need to encourage individuals to be vulnerable, to ask for help, to talk about their situations, to help us normalize this experience so collectively we can support each other and identify any gaps in services to better improve the overall well-being of Hoosiers.
And so with the national 988 number, will these calls be routed here in Indiana? Will it be someone someplace else? How does that work? How does that look?
Absolutely. So again, for the state of Indiana, this will be a few months in the making, if you will. For now, the calls will be routed through the 800 number, right, and the 988 number to the existing NSPL centers around the state. Here in a few months, we will transition over to a statewide queue system. But again, Hoosiers need to focus on their calls will be answered no matter how we are working to develop and train and get everybody on board. Currently, there are staff there, whether it's within the state or nationwide, who will answer their call. And that's something that we definitely want to drive home. There's somebody there for them.
And these crisis counselors, they have resources to help if I am part of the LGBTQ community, if I'm a veteran, they'll be able to help me more directly with my situation.
Yep, so definitely for the state of Indiana, we will employ what's known as a crisis specialist. And these specialists will be trained on all areas of individual community and individual needs. In addition to, we'll have access to specialized resources, such as what you just mentioned. So they will be trained in how to effectively listen and empathize and explore needs, right? We're going to safety plan. We're going to look for suicidality. We're going to just take a dive into why an individual reached out to us, no matter what. And it is the crisis specialist's job to ensure that they are linked to the proper resources by the end of the call. And if not, of course, the individual can always call back.
And when you mentioned some of the resources, can you talk a little bit about locally what we have available here in Indiana?
So for Indiana, again, it is county by county. Each jurisdiction has different resources based on, again, what their community has identified. So what we will do in this system is if somebody calls in and we have their zip code, for example, we will identify resources in their local community. That is always the goal, to link back to the local community to ensure that they have that support. If that community does not have that specific resource, then we look regionally, like, a region within Indiana, or we look statewide, or we look nationwide. We really do try and strive to ensure that individual has a phone number, a name, a resource that they needed when they called.
And then one of the things I've been seeing a lot in the news in regards to 988, there's a lot of concerns that starting out there will not be enough resources or enough people to answer. What can you say about that?
What I would definitely like to say is when, again, the phone number has always been there. That resource has always been there. Individuals have always been there to answer the call. That does not change. If somebody within the state of Indiana happens to call the center and those crisis specialists are busy, they're simply rerouted to the next available center who's available to take their call.
So even if locally someone is not able to answer that call because they're on another call, they will be rerouted to another person who can.
Yes.
And Jennifer, you mentioned a little bit earlier about reducing the stigma of talking about mental health. What are some things we can do in our own lives to start that conversation and reduce that stigma with the people we know?
Absolutely. Make it part of your conversation. Again, dig deep, be vulnerable. If you're noticing something's different within yourself, start the conversation with your personal physician. That is a big step for individuals. Have that conversation with a loved one that you are not feeling X, Y, and Z, and perhaps you need to get extra support or seek professional help for understanding these feelings, exploring if it is, result in a diagnosis, and how to properly treat that. From there, you look to work. Is somebody acting differently? Reach out to them. Be bold. Ask them if they're okay. Ask them if there's anything you can do to help support them. explore that, as a colleague, and even with your friends and loved ones and community and churches. If somebody is acting different, reach out. Maybe that is the step. Acknowledge, hey, you don't seem yourself lately. Is everything okay? Start that conversation and see where it leads.
Mm-hmm. And if someone is honest with me and they are sharing this, what can I do? What can I do besides share some resources? Is there anything personally that I can do?
Absolutely. The biggest compliment you could ever give anybody is to listen without judgment and give them space to share their story. It's okay to be silent. It's okay not to know what to say. That is normal. I mean, even those of us who are very seasoned and licensed, there are times we don't know what we should say in this moment. And we tell the individual that, wow, that is heavy. Thank you for sharing. And give that person space to talk. If, for example, they are having active thoughts of suicide, something with self-harm, a red flag for you, you may call the Be Well Crisis Helpline for assistance, or you may call 988 and ask, I'm sitting with a loved one. They've expressed these thoughts and concerns. What can I do here in this moment? I think more needs done.
Mm-hmm. Can you give the number for the Be Well Crisis Helpline?
Sure thing. The Be Well Crisis Helpline can be accessed through dialing 211. We have crisis specialists ready 24/7 statewide to address mental health emergencies, crises, substance use emergencies, or individuals who are calling for resources.
Mm-hmm. And when you say resources, what do you mean by resources?
A lot of our calls are loved ones trying to identify a specific provider or even a support group in their area based on that specific need. Mm-hmm. They'll call the Be Well Crisis Helpline. Our crisis specialists will talk them through, understand exactly what there is, get their zip code, and help explore support groups or resources in their area.
Mm-hmm. And that is by calling 211?
That is by calling 211.
Excellent. And Jennifer, is there anything you want to add about the Be Well program?
Be Well Crisis Helpline is accessible through 211. We are 24/7, and trained crisis specialists are ready and available for anyone needing to explore a mental health emergency, substance use crises, or a loved one who has concerns about someone around them. We're there to listen, explore for resources, and ensure you are connected to your local community for long-term care.
Jennifer, as we start to wrap up, can you is there anything else you'd like to add about the 988 National Crisis Line that will be active on July 16th?
Hoosiers need to remember that on July 16th, the access to the National Suicide Prevention Lifeline is easily accessible through a new 3-digit 988 access point. Hoosiers should realize the access to service and support remains the same. There should not be a question about who's going to pick up the phone. Hoosiers should reach out in these circumstances when extra support is needed for that help. The biggest thing is, at this point, nothing has changed. It is enhanced. As a country and as a state, there is an initiative to make this easier. The critical nature and acuity that Hoosiers have experienced in behavioral and mental health the last few years is extraordinary. State leaders, local leaders have heard this. This is to assist in alleviating and enhancing a service that already exists.
What would you say to someone who's unsure if they should make the call?
Again, it goes back to being vulnerable. Mm-hmm. And sometimes it is hard to reach out for help. as providing oversight to the Be Well Crisis Helpline, and understand that we have served over 30,000 Hoosiers in the last year and a half. We've seen Hoosiers be vulnerable. We've seen this first step in acknowledging something's different. I need help. Can you help me? With 988, it is the same mindset. There is somebody to help. There is somebody that cares. And it is okay not to be okay. Start that conversation. Get the resources you need to improve your quality of life.
If you or someone you know needs help, the Be Well Indiana Crisis Helpline is 211. And once again, that is the Be Well Indiana Crisis Helpline, which is 211. The number for the National Suicide Prevention Lifeline is 1-800-273-TALK. 1-800-273-8255. If you would prefer to text, you can text HOME, HOME, to 741-741. Thank you for joining me this week, and please join me again next week. Until then, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.